Howdy, I'm Dr. Teresa Irwin, the Vaginacologist. I have been taking care of women for almost 20 years, and I take care of the problems down there. I am board certified in obstetrics and gynecology, as well as female pelvic medicine and reconstructive surgery. So today I'm going to react to Buzzfeed, Why I Hate My Vagina.
I don't want to make anyone who watches this feel bad. It's just such an intimate thing. Vulva, 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 vulva. It's like hard to breathe. What do you think this weekend is going to be? Like, I would expect crying, maybe even nudity, and maybe even touching oneself.
So are you alone in this treehouse?
I am.
Oh.
Hello, I'm Merle, and today I'm going to be airing my largest insecurity on the internet. This is something that I've never really talked about. It's going to be an experience for all of us. Okay, I'm going to do that again. I'll do a happy one. I was a really naked kid growing up, and I loved to be naked. I would run around the house naked. So my mom was super body positive, and she always would encourage me as a little girl to take a mirror and go explore, go look at yourself. And I would do that. The first thought was like,
Her mom really is progressive. There are not many moms that will tell their daughters to go and look at themselves. That's really great. That needs to be encouraged more. Women need to know what they look like down there and to know that they are normal.
cool, this is me. This is what this is. Somewhere over time, I would look at myself and I would think, am I different? Am I the only one who looks like this? Am I the only one who feels this way? In photos online or in pornography, I would see what I thought was the normal vulva. That was very neat, hairless, pink, no drama, like a line. And I don't know about you, but I have way more going on down there.
When I trained for laser vaginal rejuvenation, she's exactly right. People look at magazines and they think that this is what they need to look like. As a matter of fact, our instructor gave us a Penthouse magazine, and that really shows everything down there. And we were basically told that this is what women are going to want, so this is how you should perform your surgeries. I don't agree with that. All women have their own vulva, just like we each have different noses. We have a different appearance of the vulvas, and that's normal.
You know what I did to try to find out if I was normal and if my body was normal? I went on the internet. I remember typing in, what does a normal vagina look like?
And that's a little incorrect. She's really looking at the vulva. Many times I have patients coming in to see me and they'll tell me, give me a complaint about their vaginas. And when I actually talk about it more, I end up finding out they really are complaining about the vulva. So the vulva is the outside. The vagina is the tube that is internal. You're not going to see it. You only see the opening to the vagina. Big misnomer.
It really did not help.
It's amazing how these young girls, I'm seeing the headlines that are coming across here, are getting surgery at the age of 9. That is unbelievable because it's not an issue for most of these young girls. It's basically because they saw a picture on a magazine and what they thought was supposed to be the way to be. So that creates really a lot of psychological problems for them, starting that early.
Labiaplasty is actually one of the fastest growing cosmetic procedures out of all cosmetic surgery. There's even reports that girls as young as 9 years old are inquiring about getting labiaplasty and changing their bodies because they feel like they're not normal.
This led me to
They want to be like Barbie. That's terrible that they feel that need at such a young age.
think, who wrote the rule book on what is normal? How is this happening and nobody's talking about it?
Marketing.
So I decided I should go talk to a surgeon.
Labiaplasty has been around just for a few decades. The first report in the medical literature was about in the early 80s. Of course, there have been other forms of labiaplasty just in terms of cultural female circumcisions or genital mutilations.
Genital mutilation is really sad. That happens a lot in Africa. They literally remove the clitoris, and these poor women now can't achieve orgasms because they never had a chance since it was surgically removed. That's intolerable.
Usually when people just say labiaplasty, they're referring to the labia minora, and that's the inner leaflet of lips, and it's the thinner tissue that tends to protrude if there's any issue.
I want to meet that designer of that pillow. It's perfect.
Issue is there.
I see patients sometimes where the labia minora is longer or asymmetrical and it bothers them. Those are patients that we can fix their labia surgically, but it's not recommended unless it bothers them.
Absolutely correct. That is when a labiaplasty should happen. If she's bothered by it, whether it's because they get stuck in her clothing, or riding a bike, it hurts, or during sex, if the labia minora get pulled in during thrusting.
So I actually tend to see patients that are a little bit younger. So patients who are teenagers who are either brought in by their parents, usually their mom. Parents, especially the mothers, are actually very supportive of their daughters. I do notice that usually it's the patients or the daughters are more nervous because they're younger, they've never had any type of surgery, and you're talking about surgery in your genital area.
So who is it that's making the decision? The mom is bringing the child to a surgeon and the child is nervous. But it could be that they're just nervous because it's their body and it's surgery.
So it's an area that they're already not very comfortable with, they're not very experienced with, and it can get patients pretty nervous.
Labiaplasty is not a benign procedure. In the wrong hands, patients can have scar tissue formation, they can have chronic pain, and their sensitivity in that area can be affected.
Now, she is correct, but really those complications and risks are very, very low because the labia minora tends to have very little sensitivity in terms of causing pain in the future and the scarring. And in terms of scarring, they actually really heal well, and scarring is minimal.
There's always risk of bleeding, there's risk of infection, and in certain types of labiaplasty, patients are at risk of the suture opening up.
Some possible complications of the labiaplasty include, of course, having asymmetry at the end. I mean, the goal is to make sure that your labia are symmetric.
That is absolutely correct. If a woman's coming in for labiaplasty and it's not purely because she's bothered by it, it's more for aesthetic reasons, you better bet that they're going to want those labia to be exactly the same. And that is incorrect. Just like we have one breast that's larger than the other, same thing. The labia are going to be asymmetrical naturally.
And aesthetically pleasing as possible.
How do we decide what
I would consider a normal or average appearing vulva to be one where the labia minora do not protrude past the labia majora, or if they do protrude, it's just slightly, less than a centimeter.
So actually, there is a medical indication in terms of length, or I should say width, of the labia minora. So when they are more than 5 centimeters at the greatest width, then that is an indication for a labiaplasty.
If you're below 4 centimeters, it's not considered like hypertrophy, like there's a deformity, but you can still get it done.
What's the youngest you perform the procedure?
In my practice is 18, but I just did it in a 15-year-old.
In my opinion, really, it shouldn't be done under 18. That way, the individual is an adult, and they made that decision on their own. Now, unless there really is a problem.
How are you feeling about this?
Am I crying?
I get nervous when I think about young girls hearing that there's some kind of a standard or some kind of a regular or a normal, when it doesn't feel like that's anybody's position to take. I like the idea that people are going to watch this and feel the way
I mean, come on, it's like saying your eye color is abnormal. That's crazy.
I have very conflicting feelings on labiaplasty. I'm not here to tell anyone what to do with their body, but I don't think it's something that should be taken lightly. And for me, I want to try to do it the homeopathic way and learn to embrace what I've got. So that led me to go to a weekend immersive experience with Pamela Madsen.
Okay, I'm already blushing. Yeah, I'm nervous. I want to ask you how you feel about A, me doing this video, and B, me going on this retreat where I think I'm going to be naked a lot with a lot of women.
I can tell you as much as possible how beautiful I think you are. But of course, at the end of the day, you know, it's a mindset that if it was so easily fixable just by someone else's words, then it would be. But I know it's something that has to click in your own head.
I appreciate Arya. He loves or likes his girlfriend for who she is, for what she is, and isn't pushing her to get something done. And that is so critical when it comes to plastic surgery, is that a woman is doing the procedure for herself, not somebody else.
Other people are going to think I'm weird and now you're dating me.
I wanted to get you weird before I started dating you. I love you because of it. Mwah.
We can talk about sex all we want, but sometimes you have to get in there and feel our bodies. Hey, I'm Pamela Madsen, and I am a sexuality educator for women. Women are taught from their first breath to be frightened of their bodies. We are covered up, our bodies are talked about. Women are cultured into body disconnection. So we don't really get to see other women's vulvas. So we have no idea what a normal vulva is. So here's the truth. There is no normal vulva.
Viva la vulva!
There are no two vulvas that are alike. You have big inner labia and small inner labia and big clits and small clits, and you come in all different colors. Isn't that amazing? And we think there's only one kind of vulva because we're only showed the one in the little girly magazine where some man decided that was the perfect vulva. My favorite story is there was infertility, being at a dinner with reproductive endocrinologists, and one was showing off about his new, really fabulous Labiaplasty program that he had. And I looked at him and said, so why are you doing that? Like, what is the reasoning behind cutting off women's inner labias? So he said to me with a very straight face, well, women with large inner labias are uncomfortable wearing blue jeans.
So function.
So yes, you should, if you are uncomfortable and bothered by it, have a labiaplasty for the discomfort that you might have with wearing tight clothing or even clothing that's not that tight. But again, it's not something that needs to be done.
Functional reasons for labiaplasty could be that the patient is having pain.
They feel uncomfortable.
They can even have some discomfort just based off of the type of clothes that they wear.
Like if they wear an underwear or tight-fitting clothes
During activities such as having sex.
with sports, you know.
Wow, really? So like men with big, like, do they come in and have their shortened?
I love that. That is great. So, yeah, tell a man that he doesn't look like the magazine, so he needs to take some of that skin off. That's not going to happen.
So that they can fit better in their blue jeans? And so they can ride their bicycle better? So, like, fake news. Perfect vulva that looks this way or that way is fake news. Perfect vulvas, that is your vulva, that's the truth.
This was a great video. It brought up a lot of points that are valid, are true, are correct, and will help women realize that it is okay with what vulva they have. If they're really bothered by it and they meet the criteria, then yes, go ahead and get it done. But do it for yourself. I'm Dr. Teresa Irwin, the Vaginacologist. Stay tuned for part 2 as I continue to react on Buzzfeed's Why I Hate My Vagina.